Hey guys, what's going on? It's Paul, and just wanted to do a video explaining um, to all you trans guys out there why I chose Dr. Charles Garramone for my top surgery. And so before I get started, let me just say, you know, this is just my experience, my opinion, and there's so many different surgeons out there. The most important thing is that before you choose a surgeon, you need to be very comfortable with them. And I've heard some things where some people weren't comfortable with Dr. Garramone for various reasons. I was, and this is just my own personal experience. The things that I express, it's not meant to offend anybody else that disagrees. I mean, we all have the right to disagree. So, and you know, I love hearing the different opinions, and I watched a lot of videos before I even decided. So, I urge you to do the same thing, and then just trust your feelings inside about when you have a consult, are you comfortable with that surgeon? So, with that out of the way, I'll go ahead and give you some of the reasons that I chose them. The first reason was price. Compared to the other ones that I checked into, his price was very reasonable. I've heard some complaints about that. I don't really understand that because I think he's the cheapest one in price that I found. So I found his prices pretty appealing. They were very low. I had actually had a consult up here where I live, and he didn't say some things that I liked. The things that I didn't like about the one up here, I live in the Midwest, so I'm not going to say his name, but anyway, here's what I didn't like when I went to the consult close to home here. First of all, he was going to charge me $10,000 for the first surgery. Then he said I would need a second surgery, which was going to be $3,000 to $4,000 in addition to the $10,000. So had I done up here near close to home, it would have cost me about $14,000, just the surgery. And that's way higher than Dr. Garramone's price. I think I roughly paid close to $7,000 or so for Dr. Garramone, including the anesthesia fees. So I mean, Dr. Garramone was charging half of what this man was charging, and it was one surgery. And also, the other guy up here said that I would have dog ears because of my size. Another thing he said I didn't like is I would not be intubated during the surgery. And I have asthma and a lot of allergies, and which made it dangerous not to intubate somebody like me. If a crisis was to happen and my airway was to shut, I've seen it. I've seen it at work when they make a mistake and don't intubate somebody that they should have, and the person starts swelling in their throat, they can't get the tube down. And that tube is the lifeline for that person to get oxygen. So that concerned me a lot. The guy up here said he wasn't going to put in the ET tube. That's kind of scary. Another thing was the guy up here did the surgery in an office, and it was about 10 to 15 minutes from a hospital. Another bad thing. I recommend you guys, whoever you do choose to do your surgery, the safest thing is to have it done in a hospital. And the reason for that is that if something goes wrong, you can get critical care immediately. It's very important. you have a small window of time when you have a crisis point with somebody where they are not breathing properly or their heart's not beating properly. You don't want to be 15 minutes from a hospital. It's not a good thing. It's not going to be a good outcome. Yeah, those were basically the things that this guy said close to home that I didn't like. So I definitely was not going to use him. So the reasons I used Dr. Garramone was he was in Florida, and my family is in Georgia, so it would have been easier to get somebody to come and help me out during my recovery period. So that was a very big plus. And yeah, that was great. So there was that. Another thing, the reason why I chose him is because I felt very comfortable with the consult. He's very detailed, very precise, and that's what you want with a surgeon. I could tell that safety was on his mind. He intubates patients. They're done at a hospital, which is what they should be. And another thing was I really liked the results I saw in people. I'm a bigger guy, and I realize it's harder to do surgeries on people like me that are kind of huskier. And I liked his results. The other people that I checked out on huskier patients, it just didn't look like I wanted it to look. And so I felt real comfortable when I saw his results. Dr. Garramone's results looked good to me. And another thing was, you know, I liked how his grafts looked too, and he placed them in the right places. I've seen other results where the nipples weren't placed properly. And another thing with him is I didn't hear of people getting many infections and things. And that's a very big deal when you're having a surgery. It's a very big risk, infection is. And that told me that he and his staff were taking steps to minimize risk of infection and post complications. So I was very satisfied, you know, in knowing that, because that can be a big problem. And you want to choose a surgeon that is going to keep the risk of infection down, because that's a very large incision, and the larger the incision, the chances of infection just really go up. So after reading about, you know, and watching his patients' videos, I didn't hear people complaining about a post-op infection, so that's very important to me. I know some people were, you know, upset because I don't know if it's true or not, but he said he trademarked top surgery or called it a certain name, and you know, I know that's a big deal to some guys. It wasn't important to me. He can call it fried zucchini souffle surgery. I don't care. As long as I don't die and he does a good job, good results, and if he keeps me safe. That's what I cared about the most. And he delivered all of those things that I was looking for. And it was good, you know. Now, when, you know, my experience with his demeanor, he's very to the point. He says the same things. And I think I heard some people complaining about that. I think I have a different perspective because, as all of you probably know, I've said it a lot, I'm in the medical field. And when I go through with an exam with a patient and a procedure, I say the same things too. So I didn't find that off-putting by Dr. Garramone. He he's trying to be very careful in making sure he doesn't leave out anything. And yeah, he's saying the same things. I guess people thought he came across as robotic, but yeah, he says the same things to people because it's the same procedure. I do that with my patients. I don't change it. And the reason I don't change it is so that I don't forget and leave out important information for my patient. So I could understand why he was saying the same things. He's trying to be precise and not leave out anything. And so that didn't bother me, but I know it bothered a lot of guys. He's not a warm and fuzzy guy. He's not going to give you a big hug. He's not going to, tell you there, everything's going to be alright. He's there to do surgery. He knows his business. He gets right down to it. He doesn't play around. And, over the years, I've worked with a lot of doctors, and that's the nature of the beast. That's how these doctors are. They're very precise, to the point. That's just doctors' attitudes, especially surgeons. Surgeons can be very hard to work with, and that's just their personalities. He didn't say anything offensive to me. He wasn't warm and fuzzy, but he got the job done, and he was to the point, but he was very polite to me. He didn't go over the top, with, I don't know how to say it, but he did enough, and he was friendly enough, and he answered my questions and my concerns very quickly. That's another thing that I like is, you want somebody who is going to know the answer to your question quickly and efficiently, and some of the other surgeons I talked to didn't. They kind of lagged and stuttered, and, well, I haven't done many of these, and, I just didn't get that from Dr. Garramone. I got a lot of confidence from him, and I felt very comfortable with him, right before I went into surgery. I knew he was going to do a good job, and, so one of the things I heard complaints about, too, is the office not being very helpful with places to stay and where to get your stuff, and I can understand that, too. That was a little bit difficult, because I'm not from the area, but, they weren't very helpful with that, so yeah, that, I didn't really like that too much, I'll admit, and it would be helpful if their office had kind of a liaison to help patients find out where to stay, where's the grocery store and drug stores, things like that. That would be very helpful if their office hired somebody to do that. I understand Dr. Garramone doesn't have time to do that. He's a surgeon. No surgeon's going to do that. I mean, as far as what I know from surgeons and working directly with them at my job, Dr. Garramone actually does a little more than most surgeons do as far as trying to deal with his patients and trying to be helpful with them. So anyway, so yeah, that's my experience, and I'll probably do another video here in a second, just saying, giving you little tips on what helped me out when I was recovering. So, but I appreciate you guys watching, and just take your time, choose wisely, and choose a surgeon that fits your needs and desires, and go with your gut feeling on it, and good luck. Happy hunting.